Welcome to the Life, Love, Everything podcast. I am your host, Tasman Buerta. This is another segment in our RSV special series that we are doing. Spread awareness, not RSV. Respiratory syncytial virus is a common cold-like, highly contagious respiratory virus which causes mild cold-like symptoms in most people. While typically mild, it can cause severe lung infections like bronchiolitis or pneumonia, which can result in hospitalization. RSV affects most infants under the age of 2 years old, with the most vulnerable population being newborn infants and small and sick newborns. What is so important to note in this series is that RSV affects all children all over the world, not just locally. And it also highlights that the most vulnerable population is most at risk, even years after the fact. Today, we are joined by fellow preemie mommy, Hanaa. She is a mom to an ex-22-weeker preemie who is now an unstoppable 3-year-old who is full of sass, giggle, and chaos. Hanaa is based in Scotland, and it's great for us to get an international view on RSV. So, Hanaa, thank you so much for joining us today.
Oh, it's my pleasure. Thank you so much for having me.
So we're going to dive straight into it. I always like to go back in time a little bit. So tell us about your preemie journey, your journey into motherhood. How did that look for you?
So Maliha was born early at 22 weeks due to both an incompetent cervix and then a failed emergency cerclage. She came extremely early. We were warned that she was unlikely to survive the birthing process. And if she did, we would have to take it day by day. She spent almost 7 months, 6.5 months in hospital in NICU.
Wow.
It was a really long time. And she had lots of different issues, holes in the heart, chronic lung disease, an eye disease, which resulted in laser eye surgery while she was still a few months old. Lots of cases of sepsis, blood transfusions, just everything you can imagine. We had lots and lots of obstacles. But she eventually came home, and she came home with an oxygen tank, and she was NG tube fed, but generally in good health. So thankful for that.
Wow. That is a journey and a half. And I'm curious to know, at 22 weeks, was she considered viable? Because in South Africa, our viability gestation is only 28 weeks.
Oh, wow. Okay. So in the UK, officially, legally, it's 24 weeks. And I got very lucky because there's only, I think, a few hospitals across the UK that will, that will sort of get involved if a baby is born before 24 weeks. So generally, most hospitals just don't have the expertise and the knowledge to care for a baby that's born so early. So it would probably just be considered like potentially a miscarriage, or a case of have the baby and then it's palliative care and you just spend time with your baby until they pass. I was really fortunate. She was born in Cambridge at Rosie Hospital, it was amazing. The level of care, the knowledge, expertise was absolutely phenomenal. So they agreed to take me in. So I was ambulanced to them. It was about an hour away from my home. And they did warn me that there's a very slim chance that she will survive, but that they would try and do all that they could to help her. And they done a fab job. They done absolutely wonderful with her.
Wow. Yeah. I always do say, because even in my own experience, it really is a case of right place, right time, or right physicians. Because I do know of children, obviously, that have been born under 28 weeks who are thriving now. But I just wanted to hear what was the standpoint on that. So thank you so much for sharing that. So you guys come home after 7 incredibly long months in the
Yeah.
NICU. And what does life look like for you guys after that, up until her getting RSV?
So we had weekly visits with her nurses, who came to our home every week to check her oxygen levels. We had to wait until her lungs were a bit stronger to then start trying to take her off oxygen slowly in very small steps. I think she came off of the oxygen at 18 months. So it took, give or take, about a year for her to become independent of the oxygen. We were under the care of a nutritionist and speech and language, who also assessed the way that if she can drink, if it's safe for her to drink, to help her encourage to start drinking fluids and taking pureed food. So she was predominantly NG fed until she was also 18 months. She never took a bottle. I breastfed her a couple times in hospital, but she just never took. It was really hard for her to develop the skills to drink while she was also on oxygen support. So, yes, we had weekly appointments with the nurses, and then we saw the nutritionist and speech and language every 2 weeks. She also saw physio every 2 weeks to just assess her mobility, how her limbs were developing, strength, in her joints, things like that. She had chest x-rays at the hospital to check if her heart, if the holes in her heart were closing up and how her lungs were developing. And to this day, she still goes to get her eyes checked every 6 months, just to ensure that the eye disease is pushed away at bay and her eyes are developing as they should. Now she is 3. So we got discharged from NICU, her NICU consultant, last summer, which is amazing. She's been discharged from everything else apart from the eye clinic.
That is amazing.
Yeah, but we're very lucky because they did say we won't do an official discharge. So if you need to get in touch with us, then you can. If there's anything that you are concerned about, then feel free to reach out and we will see her again. So I always have that sort of backup support should I need it.
Yes, absolutely. Oh,
But
that
yeah,
is amazing. It is amazing. And it helps so much. It helps so much because, a lot of times, clinicians are just waiting for you to hit a certain milestone and then it's right. Thank you.
yeah,
Goodbye. And it really does. Yeah, it just helps knowing that you have a support system because it takes a
absolutely.
village. And especially in your guys' case, it was very complex. How did support look like for you from a home base?
So my husband has always he's amazing, full on, hands on dad. So I always had him by my side. My mum lived 400 miles away, but she did come and yeah, she moved in with me prior actually to her coming because I had an issue with my emergency cerclage and I was on bed rest. So she came to help me around the house. I've got amazing in-laws who cooked food, came to visit, helped, just came to appointments with me if my husband was unavailable until I was confident going out with her oxygen tank and her feeding pumps and all the apparatus that I had to travel with.
Yes.
So I've been really fortunate. So from personal level, I've had an amazing support network. And professionally as well, like I said, they've been so supportive because a 22-weeker doesn't follow any kind of textbook guidelines. So where most moms can speak to one another or speak to their family and kind of gauge, how their babies are progressing, Maliha's development has always looked so unbelievably different. So I've been really lucky. I've had a lot of support at home and I've been really, really well supported by her medical professionals as well.
That is wonderful. That is wonderful. So let's fast forward to very recently, in actual fact, where Malia had RSV. Can you take us back to what were the signs and symptoms, and how did that journey look for you guys?
Okay. So it was in February, and she had just started nursery for the first time in January. I fully expected her to have coughs and sniffles with mixing with such a wide, just different children. But I was quite confident she would be okay, because when we got discharged from hospital, we always had the warning that she might not survive the first winter. She might not survive a cold or a chest infection. We just wouldn't know what her immunity looked like until she got unwell. And at age 1 and 2, she did get poorly over winter, but she managed to get through it. And it wasn't so bad. It wasn't as bad as what I'd expected it to be. So this year, when she started nursery, I was quite confident that her immune system was strong enough, her lungs were strong enough. I've never really restricted her from mixing. I've always tried to take her out and about to build her immunity up. So I thought, if it's colds, flus, we can deal with that. It's fine. I can't avoid the world and keep her in a bubble, because it's not good for her. But it started off just with temperature, sneezing, coughing, which was all very normal for previous times that she's been unwell. But then she slowly started eating less and then drinking less. I took her to the doctors, and they said it could just be an ear infection, so they'll start her on some antibiotics. So we had the antibiotics. It was a 5-day course, but on day 4, I thought she's getting worse, not better. So I called the GP again. We went back in, and he said, it looks like it's maybe developing to her throat. Let's try some different antibiotics. So we tried a second round of antibiotics. Now, that was on a Wednesday. She got the second lot of antibiotics. On the Saturday, she was getting worse. She was very limp, not really playing, not really engaging in anything. She was exhausted. I was checking her work of breathing. I was trying to give her, she was given an inhaler last winter just to help her along when she ended up getting unwell previously. So I tried that, and it wasn't really making any difference. And I thought, I've just not got a good feeling about this. So it was the weekend. So I called the weekend it's not an emergency service, but it's kind of just before going to hospital. And it's an out of hours doctor service. So I called them, and they told me to bring her in. And it was nighttime, so I had to get her dressed and out of bed and take her down to the local hospital. And there, the doctor said, she doesn't look great. Her oxygen saturation is a bit lower than we would like. So I think you should take her to the hospital. So I ended up in the children's ward. They gave her some medicine for her temperature. They kept us in for a few hours. Her oxygen saturation actually went back up. So they weren't concerned about that, which was a big relief for me, because although she'd had oxygen for so long, I think trying to put the nasal prongs in a 3-year-old is very different to having them on a baby, because she's so aware now. So I was really glad we didn't need to go down that route. They done a swab for COVID. They done a swab for the flu. Both of them came back negative. So they said, we're going to give you different antibiotics, take her home, try and make sure she's hydrated, and we'll send the swabs off for further investigation. So I took her back home, and we continued another 2 days, but the antibiotics were making her vomit, and what little she was eating became nothing. She just didn't want anything. So I called my GP again, and I took her to the doctors, and I said, I can't continue these antibiotics because they're just making her sick. She isn't tolerating them, but she's really not right. She just isn't herself. And this has now gone on 10 days, and she isn't getting better. She just seems to be getting worse. So the doctor looked up her notes on the system, and he could see that the swabs had come back, and she had tested RSV positive. So when he said that, I did get frightened, because I had been warned about RSV from the very beginning in hospital. She did have a vaccination in the first winter that she came home, and when she was 2 years old as well. But at 3, she was no longer eligible for the vaccination because the assumption is their lungs are strong enough, they've grown, so she won't need it. So this was the first year she didn't have that vaccination. And I know from being in touch with other NICU mums, their babies have had it who don't have chronic lung disease, which Maliha has been diagnosed with. I don't know if I said that. And other babies have been ambulanced to hospital, ended up back on oxygen. Their mouths and lips have been going blue with the lack of oxygen. So when he said that, I thought, oh my gosh, okay, this is as serious as I was thinking. I knew that something wasn't right. I was praying it wasn't RSV, but at least now we know what we're dealing with. Because it's a viral infection, he said, stop the antibiotics.
Antibiotics, yeah.
He said, if they're just causing her to be sick, they're not going to help the RSV at this point. So stop the medication, and you just have to be patient and just support her until her body fights it. And because it's been 10 days already, she should hopefully be overcoming it. So, I took her back home, waited it out. That was 10 days in. 4 days later, again on a weekend, her breathing got worse. And I thought, this is now a sort of 14 days since it started. And again, it was a weekend, so I phoned the out of hours again. They told me to bring her down. And that was at 2:00 in the morning. She was awake. She was really struggling with her breathing, sounding very wheezy, very raspy. And as soon as the doctor saw her, she said, we're not going to treat her here. You need to take her to the hospital immediately. So we ended up back in hospital. They checked all of her vitals. Again, her oxygen had recovered. Her temperature, once they'd given her more medicine, had gone down again. And they said, there's not really anything we can do. It is just a case of managing it. She doesn't need to go back on the oxygen, even though she is obviously getting quite wheezy. They done a chest x-ray to just see what was going on. And from there, they said she's actually got 2 separate infections that are attacking her. One of them being bronchiolitis. So they said we can actually try another set of antibiotics for those infections. They're secondary to the RSV, which has caused the issue. But if we give you some more medication, then hopefully it will help her fight the infections that have come as a result of the viral infection.
Yeah.
So came back home with more antibiotics, and I think it took another 2 weeks for her to get back to normal. It was really hard. So it was a good 4 weeks to finish, and after that, it took a while to get her appetite back up. She had lost a lot of weight. She's already extremely petite. She's very, very petite. She's actually underweight for her age, but they're not, the health visitors and the doctors are not concerned because she's active and she eats well. It's just her frame. She's very small.
Yeah.
So she'd lost a lot of weight. So I thought, let's take a couple weeks off. Took her back to nursery after 6 weeks off, and she straight away got unwell again, got a temperature. So I kept her off for another 3-4 weeks. And I thought, this time we're not going to go back in the winter season. I'm going to wait until after Easter, and I'll just keep her at home and do, the little children's play groups with her myself, as opposed to leaving her in nursery. And so it was tough.
Wow, I can only imagine. And okay, so there's 2 things I want to ask. I'm actually very glad that you brought up the fact, because RSV, because it's a virus, antibiotics do not work on RSV. And the thing is, I don't know for you guys, but with us, the RSV test is quite expensive. And so it's usually like, once you've exhausted all other avenues, then you test for that, just because it's so expensive. But obviously, doctors are treating the symptoms in the meanwhile, while not knowing, obviously, what the cause is, which is what happens with all respiratory infections. So how did that make you feel? Were you triggered that with all this up and down to hospital? Were you, I know I'm somebody that goes from 0 to 100. I will go from we're okay to oh my gosh, it's the worst case scenario ever. How were you feeling when you got the results that it is RSV, and of course it taking so long to resolve?
I did feel a fear that I hadn't felt before because, like I said, I really was dreading her ever having RSV because of what I already knew about it. So there was like a, oh my God, okay, this is like my worst case scenario. This is not what I wanted to deal with. But I think also I'm a bit strange in that I felt a little bit of relief that now we know what we're dealing with, because prior to that, I just had no idea. I just knew that she was so much more poorly than she had ever been before. And she was older, she was stronger. And it was strange to see her, being hit so badly this
Mm,
winter compared to when she was younger and on oxygen and so much more vulnerable. So there was a fear mixed in with, at least now we know what we're
I
dealing with.
know. Mm,
And I think because I found out it was RSV 10 days in, I knew that we'd already got through potentially the worst of it. She'd already had it for potentially those 10 days. So it couldn't hopefully get worse.
yeah.
I think if I'd found out in the beginning this is RSV, I probably would have been a little bit more scared because I didn't know what was coming. Whereas I found out when I'd seen her and how poorly she had already been. I'm quite
Right.
positive though. I've got a very positive mindset that I think I kind of taught myself when she was in NICU, because if
Mm,
I panic, then I would spiral out of control. And all of the issues and obstacles we dealt with in NICU, if I had allowed myself to spiral, I don't know how I would have taken myself back out of that spiral.
mm.
So yeah, I try to be quite positive.
That is great. It's also something that I speak to our moms in the support group. I always tell them, I'm like, feel your feelings when you are outside of that NICU. But the minute you walk in those doors, it's only positivity. I'm like, just fake it until you make it, even if
Yeah,
you don't feel like it, because your
absolutely.
baby feeds off of that energy. So I
Yeah.
think that's a wonderful mindset to have. It's something that I try to preach to myself in everyday life. But my preemie he's just turned 9 years old, and still till today, like even a little cold, I'm immediately like, is he okay? Whereas I've got other children, when they get ill, I'm not as concerned. But for him,
Mm.
it just triggers something immediately in me. Yeah, so I'm very glad that you have built that strong positive attitude. And how is Malia doing now?
Yeah, she's brilliant. She went back to nursery last week for the new spring term. She did end up getting a temperature after the first day, so she took the next day off. She was a bit poorly over the weekend, and I was thinking, I hope this isn't like just a repeat of what we've already gone through, because she really loves nursery, and I don't want to stop nursery. It's really good for her at this age, and she only goes part time, so she absolutely loves it. But yeah, over the weekend she was a little bit poorly, but she by Monday she was absolutely fine, telling me, "I want to go to nursery. I want to go to nursery." So
Oh,
yeah, she
that is
was completely
amazing.
recovered by Monday.
That is wonderful. Is there anything that you would like other parents to know, either about their children getting RSV or how to prevent spreading RSV? Because, like I said in the beginning, it does show up as mild cold like symptoms for most people. But for the vulnerable population, it can be the difference between life and death at times.
Yeah.
So is there anything that you'd like, people out there to know about the virus?
I think the first thing is, and it's easier said than done, but if your child is unwell, it's best to keep them at home. I know, however, that's not always possible because generally both parents have to work. and the child can't be at home. It's not as easy as just not going to work. So I understand it's a difficult situation. In an ideal world, if your child is suffering temperature, coughing, sneezing, it would be great to just keep them at home until that's not the case. But yeah, I think that is a bit unrealistic. I don't think it's hard to prevent it. I couldn't have done anything different for her. I don't think I could have stopped her from getting it. But I think the biggest piece of advice I can give is you know your child, and parents know their children better than doctors, better than nurses, better than most, I think, well, any medical professionals. You know when something isn't right, and you have that instinct, and it's really important that you listen to that instinct. Even if it comes back that there's absolutely nothing wrong, that's great. You know, that's what we want. But to ignore that instinct isn't going to serve you or your child well. And you need to have confidence in just believing that you do know your child best, and you know when they're just a little bit poorly, or when something just isn't right, and to act upon it.
I think that's brilliant. That is brilliant advice. Well, Hannah, you have done such an amazing job. I really appreciate you coming on to share your personal story, for being so transparent and open and honest about your journey through prematurity as well as through RSV.
No, thank you so much for having me.
It is our pleasure. And it is stories like yours that allow us to show others that a simple cold, guys, is not always just a simple cold. And that for us to be conscious and aware that we can easily infect others when we are ill. And that for some of us, it can be life threatening. And that is why through Preemie Connect, the Life Love Everything podcast, we are doing this RSV campaign because we want to spread awareness and not RSV. You have been listening to the Life Love Everything podcast with me, Tasman Botha.